But in Nakuru County, the county government has sought to do things differently to mitigate the ongoing strike by the nurses and doctors. And our reporter, Victor Ogale, now joins us with more details about how Nakuru County is tackling this particular industrial action by the two teams. Victor.
Well, Akisa, there was a recruitment that was done a few days ago by the Public Service Board of Nakuru County, and they managed to get over 120 medics who are going to perhaps fill in the gap that was left by the striking nurses and health workers. However, we managed to go around and do a spot check among various hospitals such as Miruge Karaoke Hospital in Pipeline area, the Bondeni Maternity Hospital, Langa Langa Hospital, as well as the Nakuru Level 5 Hospital, where I am right now. And normalcy is returning, though at a slow pace. Perhaps maybe there are some people that are not aware that the county has put in measures to ensure that they get service health care as it was previously. As well as, though, what we managed to gather is that mother and child care services, I can say they are at 80%. The queues were as big as they used to be. And these are measures that have been put by the county just to ensure that the people continue to get services, even as far as Bahati County Hospital. There are people who are deployed there, as well as there are doctors from the Kenya Defence Forces who are the annex, which is the private wing of the Nakuru County Hospital. And as well as you also have, there are also nurses who volunteer to come back to work, though they do not want either their faces or their photographs taken. And once they saw us in the hospital, we saw some of them trying to scatter, which is on one end, it is on humanitarian grounds. They are trying to save lives and help also abide to their code of ethics. So to shed more light on this issue, I'm joined by Alfaxed Kimboi, who's the nurse in charge here at the Provincial General Hospital, popularly known as PGH, the Nakuru Level 5 Hospital. Kimboi, very good afternoon. Welcome to KTN News. Just tell us, how are you coping with this situation so far?
With the help of the county, we are able to cope with the situation. We are getting back to normalcy. As we speak, we were deployed a total number of 30 nurses. We have 10 pharmaceutical technologists, 5 clinical lab technicians, and 10 clinical officers. As we speak, the normalcy has come back. It's only that the queues are still short. So we are providing all the emergency services, and we are able to attend to all of them.
Services such as child delivery, we've noticed most of them are going to either Bondeni or Langa Langa. Especially Bondeni, it is not a very big facility. Is in the services there, is in the facility there being overstretched because you have this high number of people coming to one facility, unlike when it was previously where others could even come here at the Provincial General Hospital?
As per the data of yesterday, I can tell you that Bondeni is not overstretched. We put measures in place that wherever there's a delivery, there are ambulance services around the county which are referring patients to facilities. In case Bondeni is overwhelmed, we've opened annex PGH hospital, whereby we're having as our operating center. We have opened a theater there. We have a number of surgeons, the obstetrician surgeons, and we've been joined by KDF obstetrician today. So he's already in theater with the anesthetists from KDF. Also, the nurses from the KDF are on standby in case we are in need of any support. They're in standby.
Well, as a medic and also an administrator of such a big facility, perhaps the new recruits that came, the new employees that were hired by the county, perhaps, how can you gauge their performance? Are they performing as it were before? How can you gauge their service?
Their services are good. They're up to the expected. They are all qualified. They were interviewed and they have all the requisite requirements. So I can say we are comfortable. They are able to deliver the services.
Yeah. The reason why I'm asking that is because people were a bit jittery when they had the county, the board was going to hire people in a few 3-4 days, and on the 5th day they were reporting at work. So that was my concern. Maybe just shed more light on that. Have you seen them maybe perhaps work and perhaps perform some of the medical duties?
I've been working with all the new recruited staff, and they are working very well. I can tell you for free here. In Kenya, we have a number of medics which are outside there. It's only that they don't have the employment. But they are qualified and they are ready to give quality services, and I can testify that we are able to give the quality services that were expected.
For medical emergencies, the emergency cases that come here, perhaps how are you dealing with them, or perhaps do you have another facility, be it a private hospital that you are referring the cases to? Maybe you have some sort of agreement when you're overwhelmed here, you refer the cases to that facility.
Okay, for the emergency cases that we are unable to handle in inpatient, for now we are operating the outpatient. The county government have gone into an agreement with a number of the faith-based facilities whereby we are able to refer the patients to.
Well, that was Faxad Kimboi, perhaps trying to put into perspective what the county has been doing. Akisa, as much as they say normalcy is returning, it is not yet 100%, because remember the number of nurses that were there before the strike and the few that were hired the other day, of course, and if the number of the patients continue trickling in as the days go by, perhaps there may be need for the county either to hire more people so that, because you might find the workload is going to be more on the nurses that are working here and also the health workers. So back to you, Akisa.
Victor, thank you very much for that. That's our reporter, Victor Ogale, joining us from Nakuru County, where the county government is said to have hired a number of 120 health workers.